Hello everyone. Very good afternoon, good evening to all of you who are listening to us today. And the purpose of our coming live today is to actually give you all our blessings and all our best wishes for the upcoming INICET exam. I know INICET is a big exam. I know getting into Central Institutes is a big dream for every medico to reach to this point, and this is now the time to make the final push. That is why we are here. And before we talk about anything else, I want you to read this line with us. You define your own life. Nobody else has the power to write the script for you. You have the power. Keep reminding yourself. Although in the last 2 years with the pandemic and the situation around it, it might seem to you that you are powerless and maybe something is happening on behalf of you, but at the end of the day, it is you have the power. You have your mindset is the most powerful thing.
And what is the kind of mindset do we need right now? So we need a winner's mindset, okay? And what exactly do we mean by when we want you all to have a winner's mindset? Number one, even some of us think to the level that, oh, INICET, I'm not capable of it, which means you rule yourself out even before trying. Yes, so the first winner's mindset that I want to give out to you, and then I'll ask Dr. Sumit to give the second mindset. So the first mindset is, do not rule yourself out. Whether it is INICET, whether it is any exam, whether you feel you've given your best or not, don't rule yourself out. Every exam that comes your way is an opportunity. Go for it, and go for it with confidence in your abilities and confidence in the work that you have done over last few months.
And the second part that we want to talk about is the content to be done in the last 3 days. Now, what happens in the last 3 days is most of the students, they get confused now what to do, because we have been playing the longer game. We have been preparing for the exam for maybe a year, 2 years, 3 years. But when we have to play the shorter game in the final 3 days, sometimes we get confused. So according to me, in the final 3 days, first resource that you should definitely look at is a resource on your eMedicoz app called as PPE kit. What is PPE? It helps you to protect yourself from the infections and everything. But on the eMedicoz app by DAMS, PPE kit is previous year paper explanation. So what happens is that in the INICET exam, you will find there is a tendency to repeat same topic, not the same question, mind my words, but the topic repeat is a very strong, because there are things that tend to be asked again and again in Central Institutes. For example, emergencies, for example, pneumothorax. So there would always be things and topics which tend to get repeated, like fast, road traffic accident. So if I am in your place, in the final 3 days, you want to feel the exam before the real exam happens. And how will you feel the exam before the real exam happens? By looking at the PPE kit on the eMedicoz app, where the previous year papers are already there. Number two, I wanted to emphasize here is that in the end, when you want to revise all subjects in a short duration like 2-3 days, it is always a good idea to look at them from a teacher's perspective. Like for example, if I am preparing the AIIMS capsule for DAMS, in my subject, what I will do is, I will cover everything that is required in crisp manner in 1 or 2 hours. Yes. So that AIIMS capsule would be again a very good idea to revise the important topics for the upcoming INICET exam. And you can also use the DVT 2022 that we have done, which is a very crisp edition of DVT where everything was revised in mind maps. And final suggestion from my side here on terms of content is emergency room. There is a program on eMedicoz app called as the emergency room, which most of you have the access to. It covers all the usual emergencies and the questions regarding them. So I feel emergencies are an important topic. That's why I'm suggesting emergency room. I feel previous year papers are very important from AIIMS perspective, and I feel rapid revision resource which can cover everything very quick, like DVT or AIIMS capsule, would be the correct way to look at things.
So let me just summarize for people who have come up. What we have said so far is that we are talking about the winner's mindset. And so far, we've included two things in the winner's mindset. The first thing was to not rule yourself out. Irrespective of what has happened so far, you're going to give the INICET exam with the mindset that you can make it big. Okay. And the second mindset strategy that Dr. Sumer has given is to limit your content in the days before the exam. It is very, very essential, and you all have to come to term to that कि बच्चे ऐसा नहीं हो सकता कि हम सारे 19 subjects फिर से दोबारा से पूरी कॉपी से पढ़ें. Right? So that is why when you're close to the exam, now, so INICET is on this Sunday. So when you're close to the exam, you have to limit the content and you have to have faith in what the faculty has told you. So doing it from the teacher's perspective is going to be more high yielding this close to the exam. So limit your content and do things that are more high yielding. So which Dr. Sumer has already summarized about DVT and AIIMS capsule, PPA kit and emergency case scenarios. PPA covers PYQs, so some of you call it PYQs, we call it PPA kit because the DAMs give explanations and videos with it. Now the third aspect of the winner's mindset that I want you to all have is that when you go into the examination hall, there is going to be this fear that you might get by seeing other students around. Maybe somebody is trying to study a lot even before the exam. Somebody is trying to, go through things right before entry into the examination hall. You have to keep your calm, right? So being calm is going to, help you in a long, long way, especially when you talk about these intensive exams. अगर कोई ऐसा क्वेश्चन आ जाता है जो आपको लग रहा है आपको नहीं आता, एक आया फिर दूसरा आया, मे बी हो सकता है 3 इकट्ठे आ जाएं, you are not going to panic. So keeping your calm helps you to maintain a balance between questions which are easy and therefore you should definitely do it right. नहीं तो anxiety में you'll end up even doing those wrong. Please understand whatever the paper is going to be, it is going to be same for everyone. There are no different sets, right? So it's the same paper for each one of you. So those 3 hours are super important now. Right? So whatever you have done so far, वो भी important था, मगर अब जो एक चीज और भी ज़्यादा important है is maintaining your calm in those 3 hours. So ensure that you don't look around, don't talk to a lot of people on the day of the exam. Just take blessings from your parents, blessings from your seniors, and go ahead with a mind that you're going to win it and you're going to make it big, right?
Now, adding to the mindset needed for the exam, one of the most important things that I always keep talking about, and I want you to today again practice it for the next 3 days, that is detach yourself from the outcome.
Yes.
Detach yourself from future issues that are in your mind. Now what happens is when you are appearing for a big exam like INICET, which can give you an opportunity to be a part of the most prestigious institutes in the country, it if you keep thinking about hey Bhagwan, can I get into AIIMS? Hey Bhagwan, मेरे को AIIMS में आ जाऊँ. Hey Bhagwan, AIIMS में आ जाऊँ. You keep putting yourself under too much pressure. So this is the time to detach yourself from the outcome and focus on the process. And please keep telling yourself कि जो होगा देखी जाएगी. Because that kind of mindset will help you. Because if you put yourself under too much stress, you will make silly mistakes. And in an exam which is highly prestigious like this, silly mistakes can pull you down massively. Okay, because they are asking usual things. Now coming to the second part of my discussion today is, one was detachment from the outcome. Second is, do not think that they will ask you unusual things. This is one of the mistakes that I have seen many students have done in the last 2-3 years, that INICET exam, when they are appearing, they are thinking AIIMS, they will ask something big, something huge, I don't know what they will ask. But when you reach the exam, they are asking usual things. Now if you're a Damsonian today, you will, when you look back at your notebooks, you will see every usual disease has been covered, and we've kind of voluntarily tried our best in the last 3 years. It's not that we don't know, but we have tried our best in the last 3 years to reduce the amount of unusual from the classes, because that is how the exam board is, that is how the global thinking behind medical education is. Globally also, even when you look at exams like USMLE, they are, unusual is being discouraged. You will find even in the INICET paper, they will have more focus on usual things. That is why I suggested emergencies for you. Third thing, beware of the demons of overthinking and underthinking in your exam. Now, my mantra is that suppose you see a question in your exam which is directly from your classes, from your class notes, has been taught to you on your live class, face to face, or on the app. If it is a direct question, what will you do? You should mark the answer with your first instinct. Because if it is a direct question and you overthink, you mark for review, ultimately what you tend to do is you then confuse it, overthink it, and get to the wrong answer, while your first instinct was correct in those questions. Okay. So mantra number 1 is, if it is a direct question from your classes, has been taught to you, from your previous year questions, from your TND papers, if it is a direct question, don't overthink, go with your first instinct, because you have already done it before. That is why you are able to answer it in a fraction.
I'm just going to disturb Dr.
Just
Sumit.
one line before I ask Dr. Deepti to take over, because
something about what you said.
Very few times I get time to speak independently like this. The second thing is underthinking. Now, suppose you have a new question. Now, there is no new topic that is being asked nowadays. It is usual topics, but the choices are confusing, and it is indirect from the class, not direct, indirect. You have to rule out choices. Then don't underthink it. Don't get कि हर एक का आंसर बी होता है. Don't think कि जो सबसे मुश्किल वाला है वही आंसर होगा. Don't underthink. Try to rule out step by step. You will get to the answer.
Okay, I was trying to say something because it is related to what Dr. Sumit just said. So he talked about the pattern of the paper, and we all know that over the last few years, we've seen that these papers, INICET or any other paper, they're not asking very unusual things, which is what Dr. Sumer was trying to highlight. And therefore, I'm going to make a second statement, and Dr. Sumer can add on to it because he does the analysis very well, is because they have stopped asking unusual things and they are going to ask things where probably the options seem a little twisted. Should you go aggressive on marking or not? My take is yes. Okay. Try and go more aggressive in the paper rather than keeping yourself defensive. Yes. So, ऐसा नहीं होना चाहिए because you are finding the options confusing, you say, अच्छा, I will not attempt it. Please understand, as long as you are aware of the topic, as long as you're at least, you know about two choices and you're confused about two, you should go ahead and mark it. Only if the paper is of a very high level and there are unusual things, there is sense into leaving those unusual things. But when the paper is coming from what you've routinely done, but the options seem twisted because that is how it is, you have to go aggressive. Don't think about the negative marking and don't keep yourself on a low attempt ratio.
Absolutely right, actually. So, I think Dr. Deepti has connected the thoughts together. Now, the idea is that suppose when you are giving the exam and you find that the paper is usual, it is of the usual difficulty level, and you probably feel it is more towards easy to moderate, it is better to go aggressive in the central exams because the number of seats is less. If you don't go aggressive, you don't have a chance to be in the top 1000, top 500. So, if the paper is easier on the easier side or on the usual side, aggression should be the key. On the other hand, if you find that the paper is very unusual, sometimes, rarely, last 3 years I have not seen an unusual paper being asked, but suppose they create a very unusual paper, there are bouncers flying over your head, you don't know what is happening in the paper, then it is better to leave those choices. Like suppose you have a question where you have no idea about the question, no idea about choices, better to leave it. So, similarly, if you find that the paper is very, very tough, then it must be tough for everybody. Going a little defensive is the better way out. Also, in exams like INICET, we expect a lot of visual questions. So, whenever you are appearing for a visual question, the key is look at the choices first, then see the image. Don't race to see the image and wildly guessing, because you don't need to make a diagnosis out of infinity. You need to only find out of 4 choices what is the answer. In visual questions, see the choice first, then see the image.
In fact, Dr. Sumer is very right, because a lot of times they're really not asking you the diagnosis when you are all the time thinking about the diagnosis. So these exams, a lot of times they're giving you a visual, they're already giving you a diagnosis as well, and they're asking you some relevant information in the question, right, in the form of options. So that is what is very important. See the image, see the options, and then go to the stem of the question, right?
And one more of my suggestion here is, which has worked for me always in my own exams, and I've actually mentored I think 1 million students in last 2 decades, is that if you can somehow start giving one mock test on the last day, it will also help you. Because what happens is, we need to come into form. Like suppose you have a cricket match tomorrow, you start hitting the ball today itself, so that you feel more in tune, more in form, because you know it, but you need to be in form. So to get into the exam mode, if you start giving one, maybe any random GT you can pick up, any, I think we did a INICET mock on the app,
well.
any INI mock, start doing a paper. You may not finish it, it's okay, but start doing it a day before.
Right.
One paper a day before always helps you to get into the groove.
And I'm going to give you a rider onto that. जो भी sir ने बोला है वो जरूर करो, because you need to get into the form, but don't worry, or in fact don't even bother
don't
to
analyze
the score.
it. That is what I said. Get into the groove. It is not about seeing the score on the last day and getting depressed or excited. It is about getting into the groove. So don't bother about the score. I think it's a very important thing.
And also I would like, maybe Dr. Samay, you can tell them something about bookmark and you know, leaving certain questions. So you know, because then you forget to sort of save, and that's very, very important.
So it's important that in INICET paper, it is different from NEETPG, that in INICET, if you mark a question for review, and if you don't save it in the end, then that question will not be counted. So advice crystal clear is, please mark very, very few questions for review later on, because if the time is less, you might lose those questions.
You have to save
do not
the
mark
options.
Too many questions for review for later on.
And also at the same time, I would say, when you go back to certain questions which you have left for review, there is a natural tendency to change answers for certain other questions also. You know, suppose you finish, let's say 40 minutes before, and you decide you want to go and review the questions that you have left. मगर उसमें क्या होता है ना, एक ऐसी भी इच्छा होती है कि अच्छा ये दोबारा देख लेते हैं, and then you tend to change your answers. Please don't do that, beta, because you know, out of 10 changes that you will make, 8 will turn out to be wrong.
Again, emphasizing that if it's a direct question from your classes, don't overthink. But if it is an indirect question, you might need to review it. That is a different story altogether, because it's an indirect question. Direct question from your classes, from your material, from your previous papers, from your, you know, discussion, go with your first instinct.
And that's why we said keep less for review, so that you're spending energy in changing things over areas that you were genuinely confused about, and not overthinking. So these are very, very important tips. Often these are lessons which are learned the hard way, but we want it easier for you. So take care of these things, you know, when you are attempting the paper.
And don't forget to manage the time well on the day of the exam. It is important to start at a good pace from the beginning itself. The only reason you lose out on the time management in the exam is if you spend too much time in the first half an hour or first 1 hour on a few questions.
True.
Now what happens is, when we are starting, एक बार सोच के देखते हैं, जब आप पढ़ना शुरू भी होते हो तो लगता है यार सब कर लेंगे यार, हो जाएगा, and you tend to overdo some subjects. Same thing happens in the exam. Okay, when you start giving the paper, sometimes you overthink on the first few questions, और 1 घंटा खराब हो जाता है, then you are crumpling, you are kind of compressing the time for rest of the questions. So it is important to keep the timer on from the beginning itself. Make sure that you have a uniform speed throughout the paper. Practice this kind of approach in your last day before the exam also. I am sure you are already doing it, but you know, make sure that you are on that, you know, flow on the day of the exam.
So it is going to be a
don't be rusty on the day of the exam. Actually.
Yes, so it is going to be a 200 questions paper, and I think yes, 35 questions in 30 minutes is fair speed to keep. Okay, so that is a fair speed to keep.
And not only that, you know, I want you also to think of this exam as an opportunity. Now what has happened is that in the last few years, because of the pressure that we all have faced as a, you know, as medical fraternity, or due to pandemic and everything put together, an exam is, you know, appearing as a, you know, add-on, say, problem
Stress.
for us or a stress for us, and we are not able to look at it at the right perspective. This INICET paper that is coming up is a window to enter into institutes of excellence in India. AIIMS, PGI Chandigarh, JIPMER, NIMHANS, these are the the gold standard places to study and train and learn the skill which will help you to touch lives and, you know, improve the lives of many thousands and lakhs of people in future. So look at it as an opportunity. एक मौका आ रहा है, उसके ऊपर एफर्ट करना है. प्रॉब्लम सोचेंगे तो स्ट्रेस होगा, एंजाइटी होगी. व्हेन वी थिंक इट्स अ चांस, लेट्स टेक इट, then it becomes better. And that, you know, adds a line to this. I see a lot of students asking me this question: sir, I think I'm not adequately prepared, should I give the exam? Answer is yes, you should, because it's a opportunity. So what should you do when you see an opportunity? You should take it. You should take it and try your best. मिलेगा तो ठीक है, नहीं मिलेगा तो कोई बात नहीं, लेकिन कोशिश तो की ना. So if you are in the position today and listening to me thinking you're in two minds, should I give the paper or not, I am making a decision for you. You will give the paper. Give the paper and see how it feels like.
I would just like to say in the end that, you know, there are a lot of uncertainties around. There could be a lot of circumstances that are hampering your studies. What is most important is that, you know, what we look at is the solution. And the only solution that is in our hands is to study. Yes, so consistently अगर हम कुछ time devote करेंगे, then INICET is a big opportunity to put you on track as well. Maybe some of you have lost track. Yes, ऐसा होता है, because when you're all by yourself और सारी responsibility हम पे आ जाती है, तो हम अपना main path का focus lose कर देते हैं, क्योंकि हमारा focus और जगह चला जाता है. So sometimes you need a landmark event to put you back on track, and I think INICET should also be taken an opportunity for that. So even if some of you really think that no, I'm not prepared for it, मैं तो NEET के लिए पढ़ रहा हूँ या पढ़ रही हूँ, still बच्चे, you should give INICET exam. Believe me, वो वापस आपके में एक जो शायद जो lost enthusiasm है वो वापस आएगा. Don't take it critically, but appear for it. Give the exam to the best of your ability. It teaches you something or the other, right? Which will help you in the upcoming exams. So, abhi ke liye, since these are last 3 days, I really want you all to ensure that you also give yourself adequate break when you are studying, because de-stressing is important. But stay away from social media in just few days before the exam as much as you can. And secondly, I would say in these few days before the exam, some consistency is very important, and sleeping on time is also very important. Please correct your sleep-wake cycle. There are a lot of good students who simply suffer because their sleep-wake cycle is completely reverse of what is required for the exams. So ensure that you are having adequate sleep, okay? It also helps you to stay calm. It reduces anxiety. So वो भी ensure करना है कि हम करें. हमें mental health का बहुत ध्यान देना है, because that helps to maintain concentration during the exam. So अभी 2-3 दिन पहले कोशिश करेंगे कि हम कुछ consistency maintain करें, frequent small breaks लें, सब कुछ पढ़ें, मगर limited high yielding चीज़ें पढ़ें. We are not asking you to restrict your subjects to only few subjects. INI people have been asking a lot of skewed distribution in terms of subjects. So get in touch with everything, but only the high yielding things, and that is why concise, crisp, rapid revision materials like AIIMS capsule or DVT turn out to be very good for last few days before the exam, right? So those are going to be my few tips which I really feel are needed as a student before the exam, okay?
In the end, let me summarize my final pieces of practical advice for you. Number 1 is sleep well before the exam. eat well before the exam so that you are not hungry on the day of the exam. कई बच्चे गलती करते हैं, वो ना करें. Then do not forget to look at previous year papers, especially of last 3 years for INICET. It would help you a lot in understanding the difficulty level of the paper. You can go through the PPE kit on the eMedicoz app for the previous papers. Fourth is look and revise emergencies. So emergency room is an important course for the last 3 days. Don't forget to look at a quick review like AIIMS capsule or DVT for your final revision. But even beyond this, even beyond the practicalities, to become a winner, you need to feel that you are a winner. एक बार सोचना पड़ेगा. ऐसे सोचो कि मैं सबसे अच्छा कर सकता हूं कि नहीं कर सकता, मैं नहीं जानता. मैं सबसे अच्छा कर सकता हूं कि नहीं कर सकता, मैं नहीं जानता, लेकिन मैं मेरी जिंदगी का सबसे अच्छा एग्जाम दे सकता हूं. एंड दैट इज व्हाट एज अ टीचर आई वांट फ्रॉम योर साइड. मैं आपसे ये नहीं मांग रहा कि आप सबको हरा दो, नंबर 1 आ जाओ, 2 आ जाओ, क्योंकि मुझे पता है कंपटीशन है. लेकिन मैं आपसे ये मांग रहा हूं एज अ इंडिविजुअल, क्या आप अपनी जिंदगी का बेस्ट एग्जाम कर सकते हो, अपना बेस्ट एग्जाम कर सकते हो, सो दैट यू डोंट हैव एनी रिग्रेट्स लेटर ऑन. The critical thing to be done in such high value exams is do your best, detach yourself from the outcome, do your best to the level that you have no regrets. असली चीज ये है कि रिजल्ट से पहले जब आप एग्जाम से वापस आए, आपको लगे मैं अपना बेस्ट एग्जाम करके आया हूं, अब जो होगा देखी जाएगी. आई हैव नो रिग्रेट्स. सो दैट इज व्हाट आई फील शुड बी द माइंडसेट इन द फाइनल 3 days. दिस इज द काइंड ऑफ माइंडसेट दैट हेल्प्स यू टू स्टे ऑन ट्रैक. नहीं तो बार बार आउटकम सोचेंगे, मिलेगा नहीं मिलेगा, ये होगा वो होगा, तो फिर हम फोकस नहीं कर पाते. सो दैट इज व्हाट आई डू बिफोर माय बिग डेज इन लाइफ.
And we'll wind up by just saying that you're very, very capable and you can do whatever you really wish to do. So create that positive energy in your mind that you are capable. ऐसा लगेगा कि सब भूल रहे हैं, कुछ याद नहीं है, मगर ऐसा नहीं है. Your brain has immense potential. You are the brightest of the brightest. So you have it in you. You don't need someone else to tell you that. You have to keep telling yourself कि आप बहुत capable हो, आप कर सकते हो और आप करके दिखाओगे. You have to cover this journey from I will to I can to I have. Okay, so all the very best from my side. Good wishes to each and every one for you, and I'm going to wait on the other side for an interview.
और बिल्कुल भूलना, ये बात आप, मैं जानता हूँ बहुत सारे बच्चे ये कह रहे हैं कि सर लगता है सब भूल गए. भूला नहीं है, सब कॉन्शियस में है. डोंट वरी. एनीथिंग दैट यू हैव अंडरस्टूड, ऐसा लगता है याद नहीं है, लेकिन जरूरत पड़ने पे पेपर में सामने आ जाता है. इट इज देयर इन योर सबकॉन्शियस. ट्रस्ट योर गट फीलिंग, ट्रस्ट योर सबकॉन्शियस. इट इज देयर. ट्रस्ट योर डेस्टिनी और ट्रस्ट योर पर्सनल लेजेंड दैट कुछ तो बड़ा आपने करने के लिए आए हो, तो वो मौका शायद अगले 3 दिन में आपके पास आने वाला है. एंड एज डॉक्टर दीप्ति सेड दैट वी आर हियर टू टेक योर इंटरव्यू आफ्टर द एग्जाम. एंड आई जस्ट वांटेड टू इन द एंड रिमाइंड यू, अपना टाइम अपन खुद लाएगा. आई विश यू ऑल द बेस्ट.
All the best.